Assalamu alaikum. Welcome to today's podcast. I am Dr. Sana, and this is a special Independence Month podcast. I am very excited to speak with a remarkable dentist from Pakistan who is currently working in Glasgow, Scotland. He has two memberships from the Royal College of Surgeons of England and a focus on cosmetic dentistry. So let's meet Dr. Zain Ul Abadeen. Assalamu alaikum, Dr. Zain. How are you?
I'm good, Alhamdulillah. I hope you are well too.
डॉक्टर जैन हमें अपनी एजुकेशनल जर्नी के बारे में कुछ बताएं. कुड यू वॉक अस थ्रू एंड हाउ डिड यू स्टार्ट, वेयर डिड यू स्टार्ट एंड व्हाट इंस्पायर्ड यू टू चूज डेंटिस्ट्री?
So, I did my schooling in Islamabad, that's where I'm from, and did my A levels, and then I applied to a few colleges. The first college which gave me admission was Bakai in Karachi, and that's where I went. And the inspiration behind dentistry was a lot of my friends were doing medicine in my class, and for some odd reason dentistry always used to fascinate me, and that's why I chose. And I chose Bakai around that time because a very close family friend of ours was just graduating from Bakai, and it was upon his sort of insistence that I choose Bakai. I went there for 4 years, did my dentistry, and I came back to Islamabad. I did my house job at Islamic Dental Hospital. After my house job, that's where my interest grew in orthodontics. तो मैंने फिर 1 साल उधर orthodontics department में demoship की, and during that time I sat my part 1 FCPS exam, and I got a place to do my fellowship training in ortho at Islamic. And I was very lucky. Had great supervisors, Dr. Ulfa, Dr. Awais, Dr. Ehsan, and they were my mentors. Plus all my senior fellow trainees. Or I did my 4 years of FCPS training. During that time, as soon as I finished my FCPS training, I never sat my part 2 exam. I got married and I moved to the UK. और फिर इधर आके फिर मैंने I sat my registration exams, OREs. उसमें it took almost 18 months to clear those exams. And then I started working here. और उसकी एक अलग पूरी स्टोरी है. How it all.
वो भी हम आपसे अभी सुनना चाहेंगे. But how was life for you as a dental student? Did you face any challenges and possibly any failures as well at any time?
Dental school was fun. I think the biggest challenge for me was moving into a different city. I was in the same school from like nursery to A levels, Beacon House School, Islamabad. So I had this close group of friends who I was with since I was 3-4 years old, and going to a different city with knowing not many people there. काफ़ी दोस्त मेरे थे जो आखिर में मेडिसिन तब कर रहे थे, तो शुरू के काफ़ी weekends I used to spend with them, but very soon I made friends in my class. फिर we rented an apartment जहाँ रहते थे इकट्ठे 3-4 दोस्त. But dentistry was good. I think the biggest challenge was just moving to a different city, but उसके अलावा it was good times.
Okay. So मुझे लग रहा है कि आप एक बहुत ब्रिलियंट स्टूडेंट होंगे, मुझे ऐसे लग रहा है.
कह सकते हैं डिस्टिंक्शंस वगैरह थी. फिर I was awarded best graduate for my year, तो I had the gold medal for the best graduate as well. So it was good.
Very nice. So are there any notable friends or mentors you would like to remember who might have helped you in your career?
In Pakistan, I would say it was I think my love for ortho was because of our professor, Dr. Irfan. He was great. And then postgraduate me again, I used to look up to Dr. Abbas, Dr. Hassan. They were always there. Then when I moved to the UK, here I found some incredible mentors who I've learned so much from.
Okay. As you said, you're a member of the Royal College of Surgeons of England. So, what was it like becoming a cosmetic dentist, and has it opened any doors for you?
The memberships, it's basically a small exam that you give, MJDF, MFDS, and that you gain sort of membership of that. Getting into cosmetic dentistry was very different and very separate from this membership. I always had the passion for ortho, creating like beautiful smiles. It was actually during COVID. When I moved, I'll sort of take it back. When I first started working as a dentist in the UK, it was a purely NHS practice. You're doing really quick dentistry, and after a while it gets to you, it catches up with you, you feel the burnout. And it was during COVID when I had time and I was on Instagram looking at these beautiful cases people put up. That's where sort of the passion really ignited. I don't see myself doing the dentistry I was doing 3-4 years prior to that for the next 10 years, and I made a decision, this is not the dentistry I want to continue doing. I need to do something else, and this is why I want to do cosmetic dentistry. During COVID, because I had so much time, there was online courses, there was online webinars people were doing, so I was just doing those. And page things opened up, I really started investing my time, money, traveling, attending these courses. And सबसे important जो पहले I was doing courses in around Glasgow, paid I traveled to London, and that's where I sort of did my course with Monique Vassant, who's a leading cosmetic dentist in the UK. And I think that one course just changed the course of my career. Uske baad I ended up doing like a year-long postgraduate in restorative and aesthetic dentistry with him. It was a diploma course, and that just changed my career completely. It opened up so many more options that I could offer patients, my skill set, understanding of patients, how to. सबसे important चीज़ जो मुझे लगी थी which I gained was the first consultation that you have with your patient, how important that is, और उस पर काफ़ी focus होता था, because you're trying to sell, I wouldn't say sell, because the patient's actually coming to you wanting something, wanting a new smile, a complete smile makeover, and you're probably just like asking them to commit a huge sum of their income on it, and how to make that investment of theirs seem worthwhile is where all that consultation process comes. So uspe I worked a lot, and that's how like the passion basically just opened up doors for me. Uske baad, once I finished that diploma, I thought, okay, maybe this is it, but uske baad I was like, no, I need to learn more, and that's where I traveled to Europe, to America, to learn more from other people, which I can mention.
Okay, आपने पाकिस्तान में भी काम किया हुआ है before going to UK. So, what is it like working outside of Pakistan, and are there any notable differences that you feel in practice, in dental practice?
There's a huge difference in how things operate. Everything's very regulated here. So शुरू में आपको वो feel होता है कि you need to do this a certain way, things need to be also a certain standard because you are being regulated. Lekin then it does become a habit कि you cannot think about doing a root treatment without rubber dam. Like, it's considered negligent here too. It just becomes a part of you at the end of it. But then there's a lot of difference within the UK if you're working in an NHS practice versus working in a private practice. Uske apne differences hai. But I think like the standard of care and the regulation, that is the main thing, plus access to materials, equipment, वो सारी चीज़ें है ही है. And I think now where I am now, like working in a private practice and things, the focus is a lot on the patient care and being really personal with them, or at least making them feel it's very personal to us what we're doing for them. I think that's what sets things apart.
Okay, and Dr. Zain, do you think dentistry has been rewarding for you? Is it worth all the hard work?
Absolutely. Like, if I was to live another life, I would choose to be a dentist. And I used to love dentistry. I used to love ortho when I was working unpaid as a demonstrator in orthodontics or a house officer. I used to love it when I got a stipend for my FCPS. So monetary value obviously is there, but the self-satisfaction you get or the buzz that you get when you finish a nice case and you show your patients the before and after, it's probably the same it was today as it was 5 years ago. And I hope it stays the same in the next 5-10 years. And that's what keeps you going, is the passion for it.
Okay, I'm gonna ask a few questions about your personal life. How do you spend your free time? What are your hobbies?
So again, in fact, after COVID, things changed a lot. Dentistry became a lot slower, and the work-life balance thing really changed. I work 4 days a week, so I have 3 days off, so I'm able to give time to family things. Summers I play cricket on a Saturday, so I play for the local county club. तो लेकिन इधर का मौसम ऐसा होता है कि आधे मैच बारिश की वजह से वैसे ही नहीं होते. तो Saturdays I spend there, बाकी Sunday और एक weekday it's with my daughters and my wife.
Okay, Dr. Zain, I've seen your picture with Dr. Appa. What was it like meeting him?
So I've followed Michael Appa for years and years, and it's not just his work which I love, it's his passion for dentistry and being like the best in the world. That's what's really inspiring for me. So when that course came up, I probably signed up within the first few days. As soon as I saw that course come up, I was like, I need to go there. Or that plus another really important person was Christian Coachman, who is the guy behind DSD, Digital Smile Design. Once I did my diploma, I was like, in my sort of practice owners, Adam and Connor, who were great mentors, who have taught me so much in the last sort of 2 years. We had a meeting and हम सोच रहे थे कि we've done courses with the best within the UK, and now we need to look beyond this. So we need to go find people who are the best in their field in the world. Or when it comes to smile design, I don't think there's a better guy than Michael Appa at Designing Smiles. I don't think there's a better guy than Christian Coachman who knows the theoretical bits about smile design. So spending those 2 days with them, with those both people, was just amazing. They both work so differently, like their end goal is the same. Michael Appa does everything by hand. He creates his own trial smiles, whereas Christian Coachman does everything digitally. So learning both those things from them was just an amazing experience. And actually, like, knowing that they're probably 10-15 years older than me, but they're still so passionate about what they're doing, was quite inspiring.
Okay, doctors, and after all that you've achieved so far, where do you see yourself in 10 years from now? Do you have any future goals?
I think I've not achieved much yet. I think there's so much to do. Every case जो we do, you post it up on Instagram और आपको 2-3 दिन वो बहुत अच्छा लगता है केस, and then you zoom in या आप देखते हो, and then you find out कि अच्छा इसको मैं इस तरह improve कर सकता था, इस तरह कर सकता था. So that constant struggle to get better will always be there. I have a few courses lined up. The more complicated cases that I'm doing, उसमें I'm finding कि occlusion plays a huge part on how to reorganize occlusion. So the best place which I found who teaches occlusion is the COIS Institute in America. So I'm planning to do a course there next year. So that's planned for next year. And then there's a few other courses which I'm planning to do. But this will keep going on. Hopefully, and I hope in 10 years' time, I'm probably working 3 days a week and having more time for myself and my family, maybe. That's the goal, hopefully.
Okay, very nice. Dr. Zain, how can a young dentist in Pakistan walk the same path as you? And is there any piece of advice you would like to give them? Since you have also been a demonstrator, तो आपको होगा अंदाज़ा कि student life किस तरह की है पाकिस्तान में?
I speak to fresh graduates और उसमें I think like if I could go back, any advice I would give myself maybe as a fresh graduate was to take more photos of your work, more for self-learning. Things I wish I started using rubber dam before and got more comfortable using rubber dam before. Usse your work just doesn't need to be indirect, direct work, anterior, posterior work just gets so much better. And there's no excuse not to use it. It's so cheap. The technique, once you start using it, you'll get better at it. So start using rubber dam, take lots of photos. What else? I would say like keep things very simple. जो treatments मैं करता हूँ, nothing is complicated in them. It's very simple ortho, simple composite work. So it's very simple and you don't need to कि आपको बहुत कोई complicated चीज़ करनी है clinically. Keep things really simple. I would advise them to, if they're looking to get into cosmetic dentistry or learn a lot about tooth morphology. Follow people who are doing really good work. I did a course recently in Italy with a Brazilian dentist called Cliscio Alves. He's one of, in my opinion, his composite works so good. लेकिन उसमें find people you like the style of their work and just follow their Instagram, look at their cases, see nice shapes of teeth. क्योंकि once you have in your mind what looks nice, you're able to then reproduce it. So I think for cosmetic dentistry, these are the three things I would say. Rubber dam use करें, take lots of pictures, invest in a good camera kit. I see people उनके पास like when they ask me about photography and things, they would have like the latest iPhone. But when you say okay, use a DSLR, they will say नहीं उसके लिए पैसे नहीं हैं, it's expensive. A DSLR is probably cheaper than the latest iPhone. So I would recommend investing into a good camera kit and also like following leading cosmetic dentists from the world on their Instagram and just having a look at their cases.
So, Dr. Zain, thank you so much for your time. It was an honor talking to you, and I feel so proud seeing a dentist from Pakistan making a huge impact internationally. Your talent, dedication, hard work is really fascinating and impressive. Thank you so much for your time. Until next time.
You're too kind. You're too kind.